Stroke is one of the leading causes of death worldwide. Therefore, recognizing the symptoms of a stroke and seeking medical support when necessary is vital. But what exactly is a stroke? What are its symptoms? What preventive measures can we take? In this video, we'll learn about what a stroke is, how it occurs, its symptoms, and lifestyle changes that can help prevent it. Before we start, don't forget to subscribe to our channel and like the video to join our community. Let's begin. What is a stroke? A stroke is a serious medical condition that occurs when the blood flow to the brain is interrupted, causing damage to brain cells. This happens because the brain tissue doesn't receive enough oxygen and nutrients. A stroke requires immediate medical intervention, and quick treatment is crucial to minimize damage. Strokes generally occur for two main reasons. 1. A blood clot forming in the brain's blood vessels blocks blood flow and prevents brain cells from getting oxygen. This type of stroke accounts for about 85% of all strokes. 2. Plaques made of cholesterol and other substances accumulating in the blood vessel walls can narrow or completely block the vessels, preventing blood flow to the brain. When brain cells are deprived of oxygen, they start to be damaged quickly. This damage can begin within minutes, and, if untreated, can lead to permanent brain damage or death. Early stroke signs. 1. High blood pressure. Ischemic stroke occurs due to blockage in the brain's blood vessels and is the most common type of stroke. Hypertension, high blood pressure, increases the risk of this type of stroke by causing hardening, atherosclerosis, and narrowing of the arteries. High blood pressure damages artery walls and leads to plaque formation, which makes it easier for blood clots to form. Chronic high blood pressure constantly stresses the brain's blood vessels, causing them to be damaged over time. This can lead to small vessel diseases in the brain, resulting in cognitive decline, memory problems, and dementia over time. Hemorrhagic stroke occurs when a blood vessel in the brain bursts. High blood pressure can weaken the walls of blood vessels, leading to rupture and causing bleeding in brain tissue, which can result in serious damage and potentially fatal outcomes. Controlling high blood pressure significantly reduces the risk of stroke. This includes lifestyle changes, dietary adjustments, physical activity, and medication. Regular blood pressure monitoring and intervention, as advised by a doctor, are critical in managing stroke risk. Regular health checkups and following medical advice are crucial for individuals with high blood pressure to reduce stroke risk. 2. Excessive fatigue. The relationship between excessive fatigue and stroke is complex and multifaceted. While excessive fatigue is not a direct cause of stroke, it is associated with various indirect factors and conditions that can increase stroke risk. Excessive fatigue is often linked to high levels of stress. Chronic stress causes the body to continuously release high levels of cortisol and other stress hormones, which can increase blood pressure and lead to hypertension, a major risk factor for stroke. Excessive fatigue is often associated with a lack of sleep or poor sleep quality. Sleep disorders such as sleep apnea can cause oxygen levels to drop and blood pressure to rise, significantly increasing stroke risk. 3. Vision problems. A stroke damaging the brain's visual areas can reduce visual acuity and cause disruptions such as spots or dark areas in the visual field. It can also affect the nerves controlling eye muscles, leading to double vision. Some stroke survivors may lose part of their visual field. For instance, a stroke in the right hemisphere of the brain can cause a loss in the left visual field, a condition known as hemianopia. 4. Sudden and severe headaches. Sudden and severe headaches can sometimes signal an increased risk of stroke. If a headache appears abruptly and intensely to the point where you might describe it as the worst headache of my life, it could be a symptom of a stroke type called subarachnoid hemorrhage. If this headache is accompanied by symptoms such as numbness or weakness on one side of the face, difficulty speaking, vision problems, loss of balance, or loss of consciousness, the risk of ischemic or hemorrhagic stroke is high. Certain vascular headaches, especially migraines, can increase stroke risk. Individuals with migraine with aura have a higher risk of stroke compared to the general population. Therefore, immediate medical attention is crucial if you experience these symptoms. 5. Numbness or weakness in extremities. Numbness or weakness in the extremities is a common and significant symptom of stroke. Stroke typically occurs due to a sudden interruption of blood flow in the brain, damaging specific areas. Depending on the affected brain region, Symptoms such as sudden weakness or numbness can occur in specific parts of the body. These symptoms usually appear on one side of the body. Stroke often affects one hemisphere of the brain, causing sudden weakness or numbness on the opposite side of the body. For example, a stroke in the right hemisphere can cause weakness or numbness in the left arm and leg. A person may suddenly be unable to move an arm or leg, or feel a sense of weakness, significantly affecting their ability to walk or hold objects. 6. Speech problems. Speech problems can be a significant indicator of stroke, manifesting in various ways depending on the stroke type and the affected brain region. If a stroke affects the left frontal lobe and temporal lobe, which are responsible for language and speech, it can cause a condition called aphasia. This condition may present as difficulty finding words, forming sentences, and understanding or correctly using words. When areas of the brain involved in motor speech control are affected, it can cause dysarthria, making it difficult to articulate words properly and speak clearly. Hemorrhagic stroke resulting from brain bleeding can similarly damage the language and motor speech centers, leading to aphasia or dysarthria. Bleeding in the brain can create pressure on different areas, impacting speech abilities. Immediate medical help is crucial when these symptoms occur. 7. Hallucinations. The occipital lobe, responsible for visual processing, can cause visual hallucinations if affected by a stroke. These hallucinations may manifest as seeing things that aren't there. The temporal lobe, associated with auditory processing and memory, can lead to auditory hallucinations if affected, causing individuals to hear sounds that aren't present. The parietal lobe, involved in processing sensory information like touch, temperature, and pain, can cause tactile hallucinations if affected, leading to sensations like bugs crawling on the skin that aren't real. 8. Neurological problems. Stroke survivors may experience short-term and long-term memory loss. Short-term memory loss can cause difficulties in remembering new information, while long-term memory loss may involve trouble recalling past events or issues with storing information in long-term memory. Stroke can affect the cerebellum or brainstem, which control balance and coordination, leading to gait disturbances and balance issues. Brainstem strokes can cause symptoms like nausea and vomiting, as this area includes brain regions controlling stomach and bowel functions. Vestibular system involvement, which carries information between the inner ear and brain, can also result in nausea and vomiting. 9. Loss of coordination. The cerebellum, involved in coordinating movements, balance, and muscle tone, can be affected by a stroke, making it difficult for individuals to control their balance and movements. This can lead to coordination loss in walking or simple motor movements. The basal ganglia, crucial for initiating and controlling movements, can be impacted by a stroke, leading to motor disorders like involuntary movements or slowed movements. The brainstem, which controls many fundamental functions, can also be affected, preventing stroke. Making these lifestyle changes can significantly reduce the risk of stroke. A low-fat and low-cholesterol diet helps maintain blood vessel health and reduces atherosclerosis risk. Consuming plenty of fruits, vegetables, whole grains, and lean protein benefits heart and vascular health. Limiting sodium intake can reduce the risk of high blood pressure. A regular diet program indirectly reduces stroke risk. Regular exercise reduces stroke risk, such as at least 150 minutes of moderate aerobic activity or 75 minutes of intense aerobic activity per week. Exercise helps lower blood pressure, regulate cholesterol levels, and control weight. Maintaining a healthy weight reduces the risk factors for stroke. High stress levels increase stroke risk. Stress management techniques, meditation, yoga, and relaxation exercises can help. Remember, stroke requires immediate medical intervention. Recognizing stroke symptoms early and seeking quick assistance is crucial to minimize brain damage. Regular doctor visits are essential for definitive results. If you've watched this far, don't forget to subscribe to our channel and like the video to join our community.